I'm Dara Halpin and I'm the founder of Sheela.ie. At Sheela, we're on a mission to empower you to take care of your pelvic floor health. This week's video is all about what causes pelvic floor issues. It can be confusing and frustrating to talk about causes when we're talking about pelvic floor issues like pain, prolapse and incontinence. That's because the complete picture of what causes pelvic floor issues is just not clear. Pelvic floor issues are complicated and they're affected by lots of different things. Sometimes you might develop an issue because of a specific thing like an injury, but that doesn't mean other things aren't having an impact on how your pelvic floor is working too. When we talk about pelvic floor issues, it's much more helpful to talk about risk factors. The combination of risk factors affecting your pelvic floor and how it responds are unique to you. If you have one or more risk factors for pelvic floor issues, that doesn't necessarily mean that you will definitely have a specific issue. There are risk factors that we can do things about and risk factors that we can't. Understanding what these are is really important because it can help us prevent pelvic floor issues in the first place and treat our symptoms if we have them. One of the well-known risk factors for pelvic floor issues is pregnancy. During pregnancy, your pelvic floor muscles have to work harder to support the weight of the growing baby, the extra fluid, and the placenta. They also become softer and more stretchy due to the pregnancy hormone relaxin, which affects all the muscles and tissues in your body. Healthy pelvic floor muscle tone helps keep bladder and bowel control throughout pregnancy. It also helps reduce the risk of prolapse during or after pregnancy and helps with the recovery after birth. This is why it's recommended that pregnant women do Kegel exercises or pelvic floor squeezes and continue them after the birth. After pregnancy comes childbirth. During childbirth, there are many things that can happen which can increase the risk of pelvic floor issues. A C-section doesn't necessarily reduce your risk of pelvic floor muscle weakness because of the risks we already discussed about pregnancy. In a vaginal birth, as the baby moves down the birth canal, the nerves and muscles of the pelvic floor stretch to allow the baby to come out. But sometimes the muscles can become overstretched and weak, and they can't keep wee, wind or poo inside as effectively. This is more likely to happen if your baby's more than 4 kilograms, you have a long second stage of labour, your baby is delivered with the help of forceps or a vacuum, you suffer a 3rd or 4th degree tear, or you have an episiotomy. There are lots of things you can do to reduce these risks during childbirth, including adopting more active positions during labour, using gravity to help push the baby out. Your midwife can actually actively support your pelvic floor while you're delivering your baby. You can do pelvic floor exercises during pregnancy and after the birth, and you can massage your perineum to prepare it for stretching in the weeks leading up to the birth. If you have any concerns about your pelvic floor being at risk during childbirth, talk to the medical professionals who are attending you and they will support you. Then there are the lesser known risk factors. The biggest category of these are factors that put pressure on the pelvic floor. They include obesity, chronic coughing, chronic constipation, straining and pushing when you're doing a poo, heavy lifting and impact exercises like running and jumping. Obesity increases the load on our pelvic floor muscles and holds our muscles in a stretched out position. That makes it much harder for them to contract effectively. Healthy diet and regular exercise can help you lose weight and reduce the pressure on your pelvic floor. Stress incontinence is really common and it's caused by a combination of increased abdominal pressure, that's pressure inside your tummy area, and weakness of the pelvic floor muscles, which means your pelvic floor muscles can't contract quickly or strongly enough to stop leaks. When we cough, sneeze or laugh, there is a fast and high impact load of intra-abdominal pressure which squeezes our bladder, and our pelvic floor muscles need to contract fast and strongly to prevent any leaks. If we have a chronic cough, this can tire those pelvic floor muscles and put them under strain. One way to help your pelvic floor support your organs and manage your incontinence symptoms is to practice the knack. This is when you squeeze your pelvic floor muscles inwards and upwards and pull your belly button back towards your spine just before you cough or sneeze and hold it there. This will protect the pelvic floor muscles from further damage. Chronic constipation and straining when pooing can also damage the pelvic floor. We have a whole video on this that I'll link to below this one. You can prevent constipation by eating enough fibre and reduce straining by using a step for your feet when you do a poo. Heavy lifting can damage the fascia in the pelvis, which can limit pelvic floor function. This is particularly true if we hold our breath while lifting. can do the knack, as I've just explained, and exhale as you lift, and this will help protect the pelvic floor muscles. You can bend your knees and help protect your back too. Impact exercises like running and jumping can also cause similar fascia damage. Landing increases the downward pressure on the pelvic floor, so the muscles have to work harder to stop leaks. You can modify your exercise routine to reduce the heavy landings and get some support from a specialist physiotherapist who can give personal advice about impact exercise. Getting older and going through menopause is something that we can't avoid, and this can have a big impact on our pelvic floor muscles. During the perimenopause, there are lots of hormonal changes in a woman's body, including a decrease in the hormone estrogen. Estrogen plays a critical role in maintaining the health and function of the pelvic floor muscles. When estrogen levels decrease, the pelvic floor muscles can become thinner and weaker, losing their elasticity and their ability to contract and relax. We're particularly at risk if we already have a weakness, maybe from a birth injury or another risk factor. Hormone replacement therapy and local estrogen creams can help maintain muscle strength, and regular pelvic floor exercises can also help improve muscle tone. Some people are genetically predisposed to having weaker muscle tone, and that can lead to pelvic floor issues. Some studies suggest that more white and Latino people suffer pelvic floor issues than other races. Some traumas, like a car crash, can impact pelvic floor function, and some surgeries can have consequences for your pelvic floor. Bizarrely, one of the surgeries that increases your risk of pelvic floor issues is previous pelvic floor surgery. This is because failure rates for prolapse surgeries can be as high as 60%. But despite this high failure rate, many women still report increased quality of life and improvement of symptoms. Finally, chronic stress is a risk factor for pelvic floor issues. The muscles of the pelvic floor contract in direct response to physical and mental stress. This is known as the pelvic stress reflex response. When we're chronically stressed, this can lead to a hypertonic pelvic floor. That's when the pelvic floor muscles are hard to relax, which also causes urinary or wee incontinence symptoms. Learning how to manage stress using simple techniques like belly breathing and meditation can improve pelvic floor issues caused by overly tense muscles. If you'd like to know more about how stress is affecting your pelvic floor, we have a video about that too, so I'll link to it below. Whatever your unique circumstances, it's likely that you will encounter some of these risk factors at some point in your life. The important thing to remember is that no matter your age or your circumstances, there are many interventions to help you prevent, manage, and treat these issues. That's it for this week. I hope you found this video helpful. If there's someone you think could use this information, please do share it. Don't forget to like and subscribe, and join us next week for more practical hints and tips to help you take care of your pelvic floor. Thanks for watching.